Hi everyone, this is Your Health Today. I am Dr. Olaide Junior. We'll be talking about peptic ulcer today. Now, what is peptic ulcer? The word peptic is a blanket statement for the stomach and the duodenum, or rather, let's be more technical. Gastric ulcer and the duodenal ulcer. What is gastric ulcer? When you hear the word gastrum is Latin for stomach, so it just means ulcer of the stomach. What is an ulcer? An ulcer is a wound that refuses to heal, a very stubborn wound. So a gastric ulcer is a stubborn wound, one that refuses to heal in the stomach. While the duodenum is the first part of your small intestine. I'm just testing your basic biology. So when you have a wound that refuses to heal in the first part of your small intestine, you call it duodenal ulcer. Now these places have different locations. When you're talking about gastric ulcer, you feel a pain somewhere here or here that refers or radiates to the back. When you're talking about duodenal ulcer, you have a pain somewhere here on the right that radiates to the back. So now we'll tie it down. We'll tie it all up. Gastric and duodenal ulcer all together is known as peptic ulcer. Alright, how common is peptic ulcer? It's quite common. Close to 50 to 60% of the human population have it. Let's talk about the causes. Contrary to popular demand or popular opinion, people keep thinking that number one cause of ulcer is fasting, not eating regularly. Let me burst your bubble today. That is not close. The number one cause of peptic ulcer disease is a bacterium, a very nasty bacterium known as H. pylori, or better still, Helicobacter pylori. Okay, now this is common or occurs in 60 to 70% of the human population. A lot of us are carrying the H. pylori bacteria. Now when you have this bacteria, it can predispose you to peptic ulcer disease, it can predispose you to colon cancer and some other nasty things which are not in the scope of this video. So that's the number one cause of peptic ulcer disease. So mothers who are fond of using their mouth as coolants for their babies while feeding them, putting the spoon in the baby's mouth, and if you have H. pylori, you just infected your baby. Number two cause of peptic ulcer is prolonged use of a group of pain relievers we know as NSAIDs, non-steroidal anti-inflammatory drugs. Examples are your common ibuprofen, diclofenac, Felvin, aspirin, mefenamic acid, indomethacin. There are so many of them, but once you see that they're NSAIDs, you run from them, because when you use them for a very long time, it can predispose you to peptic ulcer. Now I've noticed that a lot of young ladies come down with peptic ulcer due to this cause. Why? Because when young ladies have menstrual pain, they get advices from their peers or from their parents, their moms, that why don't you just use Felvin? So before you even feel the pain, you start getting used to the drug, even on an empty stomach. When you take Felvin and every other NSAID for a very long time on an empty stomach, you are prone to having peptic ulcer. Another class of drugs that can predispose you to peptic ulcer are steroids. You know, the NSAIDs are non-steroidal anti-inflammatory, and this one are the steroidal anti-inflammatory drugs. They are steroids. Examples are dexamethasone, prednisolone. Now, who are the people that are more prone to this? People who use steroids. You could talk about asthmatic patients. When you're using these drugs, be warned that you're not meant to use them for a very long time. You know, in this part of the world, we are so used to abusing drugs, so we just use drugs anyhow. So stop abusing these drugs. Okay. Cause number 3. Now we can talk about prolonged fasting. Now, when you fast for a very long time, you know, it can predispose you to peptic ulcer. Cause number 4. Chronic alcohol consumption. Now, mind you, not everybody that consumes a large amount of alcohol will come down with peptic ulcer, but when you start doing this over and over on an empty stomach, you are prone to having peptic ulcer. Cause number 5. When you smoke cigarettes for a very long time, you know, and I also bring out this disclaimer, it doesn't mean that everybody that smokes cigarettes will come down with peptic ulcer, but this is a common cause of peptic ulcer. Cause number 6, consuming acidic fruits and foods. How do you know something is acidic? When it has a sour taste. An example of sour or acidic fruits are the citruses, that the oranges, your lime, your lemon, your grapes, or whatnot. You take them, you notice they are sour, especially unripe oranges. Drop them. If you already have ulcer, these citruses would predispose you to an ulcer attack or an ulcer crisis, so to speak. So just avoid them. Avoid unripe pineapples. Even ripe pineapples, they're very rich in vitamin C. Vitamin C, another name for vitamin C is ascorbic acid. So it's an acid. So you avoid anything acidic. Don't forget what I said. Anything that has a sour taste is most likely acidic. Now let's talk about food. Okay? Very sour gari jebu, fufu. Anything that is sour, just avoid it. It can predispose you to peptic ulcer. Cause number 7, when you consume a large amount of oily food, keep frying, you even fry the water you take your bath with, you fry everything, you will predispose yourself to peptic ulcer. Cause number 8, fizzy or carbonated drinks. Now, mind you, this will not cause it's not a direct cause, but could predispose you to peptic ulcer, especially if you've had it already, it can aggravate it. Okay, so peptic ulcer, carbonated drinks, 7-Up, Coke and all that, if you must take them, open it, let a large amount of the gas escape, and drink your fizzy drinks. But without doing that, you would really come down with an acute exacerbation of peptic ulcer. Cause number 9, lying down immediately after eating. I can't overemphasize this. Please stop lying down immediately after eating. I would like to make a video for this later, not this one. But please do not lie down immediately after eating. It can predispose you to gastroesophageal reflux, a twin brother or cousin of peptic ulcer. Another cause again is this: consuming legumes like beans, especially at night. Avoid beans and bean preparations like akara, moi moi. You avoid these things because, especially at night, because they don't digest so well. You wake up with a lot of nasty tummy next morning, bloated belly. So it's advisable you avoid it. A tremendous amount of stress too can predispose you to peptic ulcer. So these are things you must at all costs avoid. Now let's talk about how it's being treated. Depending on the cause of your peptic ulcer, you see your doctor. If it's the H. pylori, the very first one, which you must eradicate, your doctor gives you some classes of drugs called a triple regimen. See your doctor for that, or reach out to me. You could reach out to me personally for the treatment. Okay? Like I said, depending on the kind or the cause, your doctor will be in the best place to tailor your treatment modality to your case. Now, a lot of people ask me, is there a cure to peptic ulcer? I just said something that peptic ulcers are wounds that refuse to heal. Now, the fact that you had a wound on your skin doesn't mean you're immune. You just have to avoid another wound. Okay? Likewise, now you've seen the causes and the risk factors that I just outlined now. You avoid these things. You have to modify your diet, watch what you take and watch what you shouldn't take, and you'll do pretty fine. Alright, thank you for listening. I would love you to like, share your comments, post your questions, tag your friends, and don't forget to subscribe to my YouTube channel. Thank you very much.